Hey everybody, welcome to this edition of 5 Minutes Less of EMS. I'm your host, Kevin Mackey, coming to you today from Sacramento City Fire Department EMS Division Training Room. Today's topic is sepsis. We have talked about sepsis in the past, and we want to talk about it a little bit again. Our protocols changed on July 1st. A couple things were added, and so I want to make sure I hit the high points of that. But I'm going to start by giving you the answer to the test. The answer is 500 cc's of fluid. The question is what do we administer to all patients we suspect of having sepsis, especially the ones that we're going to do a sepsis alert on. So let's quickly review again the SIRS criteria. If you remember, there's 3 of them. It's a temperature less than 36 degrees Celsius or higher than 38. It's a heart rate greater than 90, and it's a respiratory rate greater than 20. But these SIRS criteria are really the body's response to an infection. When you have the infection with the SIRS criteria, that is what makes a person septic. When their blood pressure is low, that is what we call septic shock. So, on July 1st of this year, if you live here in Sacramento and you're watching this video, we had in our prior protocols those criteria and a suspected infection that's reported by the family member, the caregivers, something you find on your physical examination, or very important, pay close attention to this. Be very wary of the older patient or the person with immune compromise, cancer, chemotherapy patients, diabetics, folks who have chronic medical conditions, end-stage renal disease, renal failure. Make sure you're watching for new onset altered level of consciousness and have sepsis somewhere in your differential diagnosis. So, the new protocol that started on July 1st added in 2 more things. It added in a blood pressure less than 90, but it also added in end-tidal CO2. If you're using nasal end-tidal CO2, if the end-tidal CO2 is less than 25, that is one of the 5 criteria in addition to suspected infection that will send you on a path to calling a sepsis alert. So I want to talk a little bit today about like the physiology of sepsis, because I think once you understand that, then I think you kind of get the whole picture. All right, if you're a fan of Ninja Nerd Medicine, you know that they're wizards at drawing. I'm going to give my shot at it. I'm going to draw out what sepsis develops like in our body and then how we measure it in the field. Maybe a little oversimplified, but let me explain. We've introduced a bacterium or a virus or a foreign substance into our bloodstream, and it's encountered by our white blood cells. Our white blood cells ingest that foreigner that doesn't belong and then sends off a bunch of chemicals. Some of those chemicals are called interleukin, not that this matters. Some are called tumor necrosis factor. It's all the kind of stuff that I learned in microbiology way back when in college and also in medical school. But basically, these are the chemical communicators that go throughout the body and tell our body that there's something here that doesn't belong. So as a result of these chemicals, it goes to the thalamus in our brain and it basically resets the thermostat in our brain and makes us hyperthermic. So people get a fever. That's basically what causes a fever in an infection. But what's interesting is when you raise the temperature in a human body, you also raise the metabolic rate basically, and you increase the heart rate and you increase the respiratory rate. So hence, in our SIRS criteria and also in our diagnostic criteria, we have a respiratory rate over 20, we have a heart rate over 90. That's where those 2 are coming from, okay? But at the same time, these chemicals communicate back and they loop back to the blood vessels in our body and they make them leaky. So things start to leak out. As a result of these leaky vessels, we have a drop in perfusion throughout the body. So as that perfusion drops, we also see our blood pressure drop. We see a rise in lactate, and because we're also hyperperfused, we're going to see a drop in our end-tidal CO2. So therefore, we hit them all. We've hit our respiratory rate, our heart rate, our temperature, our blood pressure, and our end-tidal CO2. So we have 5 things because we suspect there's an infection present. So let's get back to that first question I asked, which is the test question. Do we give 500 cc fluid boluses to anybody we suspect of sepsis, regardless of what their blood pressure is? Well, that's a really good question because we were all trained to use fluids to treat low blood pressure. But in this particular circumstance, this person's in basically compensated shock. So they are compensating for what's going on in their body and holding their blood pressure up by driving their heart rate up and a few other things, but we need to treat them and start them on a fluid bolus because they need it. They're intravascularly dry. They're fighting an infection and they need the fluid bolus. So I hope this helped paint a better picture of sepsis. I hope it kind of cleared some things up for you. Thank you for the great work you do. It's truly an honor to work with all of you. And I hope to see you next time on the next edition of 5 Minutes or Less of EMS.